At first glance, acute pancreatitis might not seem all that complicated, but it's hiding a huge challenge for doctors. How do you predict which cases are about to become life-threatening? Well, today, we're going to dive into a really powerful tool designed to answer that exact question. So what's actually happening here? Well, acute pancreatitis is basically when the pancreas starts digesting itself. It's often kicked off by things like gallstones or alcohol. And here's the kicker. While a lot of cases are pretty mild, the course of the disease is just dangerously unpredictable. It's a medical emergency that doesn't always show its hand right away. And that, right there, is the huge problem. If you're a clinician on the front lines, your biggest challenge is telling the difference between a mild case that'll resolve on its own and one that's about to spiral into an absolute catastrophe. At first, they can look exactly the same. So how do you spot that danger before it's way too late? Okay, so to really get why this tool we're talking about is so important, you first have to appreciate the problem itself. And the truth is, pancreatitis kind of lives this double life. It has two very, very different faces.
On one side of the coin, you've got mild pancreatitis. The patient gets better, there's no organ failure, and you can manage them on a regular hospital ward. But then you have the severe form, and this is a whole different beast. We're talking about necrosis, where the pancreas tissue literally dies. We're talking about multi-organ failure and a tragically high mortality rate. These patients don't just need a hospital bed, they need the ICU, and they need it now. The stakes couldn't be higher.
And get this, everything, and I mean everything, comes down to those first 2 days. That early phase of the disease is what determines the patient's entire outcome. It is, quite literally, a race against the clock to stop the entire body from shutting down.
So what does that downward spiral actually look like? Well, it all kicks off with severe inflammation in the pancreas. But that fire doesn't stay put. It triggers a massive body-wide inflammatory reaction, what we call SARS. And from there, it can just cascade into multiple organ dysfunction syndrome, or MODS. That's when vital organs, the lungs, the kidneys, they just start to fail.
And this is the bottom line. Every single moment of delay in spotting this cascade, it directly increases the patient's risk of dying. Being able to predict this before it really takes hold isn't just a nice to have. It's a matter of life and death.
So how in the world do clinicians crack this code? How do they see what's coming? Well, that's where this incredibly clever and surprisingly simple tool comes into play, the Modified Glasgow Score. Okay, so what is it? In a nutshell, it's a checklist. It uses 8 really common clinical and lab values, all gathered within that critical 48-hour window, to spit out a single score that predicts if a patient is heading down that dangerous path to severe pancreatitis. And what's so great about this tool is just how accessible it is. Because let's be real, in a chaotic ER, you need something you can remember. So they came up with this awesome mnemonic to remember the 8 parameters. PANCREAS. Each letter stands for a different red flag the body is waving.
All right, let's just pick one of these to break it down. C is for calcium. If a patient's calcium level drops below 2 millimoles per liter, that's a point. But so what? Why does that even matter? What is the body actually trying to tell us with that one little number?
And this is where it gets really fascinating, because it connects right back to the biology. In severe pancreatitis, you get this thing called fat necrosis. The dying tissue literally starts sucking up calcium from the bloodstream, making the levels plummet. So you see, a drop in calcium isn't just some random lab value. No way. It's a direct biochemical footprint of a severely injured pancreas.
Now, you might be thinking, is this the only scoring system out there? And the answer is no, definitely not. But, and this is a big but, there's a really good argument to be made that in this case, simpler is actually a whole lot smarter.
Let's do a little showdown. When you stack the Modified Glasgow Score up against some of the other big names like Ranson's criteria or Apache 2, the advantages are crystal clear. Those other scores, they can be super complex, they need specialized data you can only get in an ICU, and they can just take longer to figure out. The Glasgow Score, it's fast. It uses routine lab work that basically any hospital can do, and it gives you an answer inside that crucial 48-hour window.
And that right there, that's its superpower. Because it relies on simple, everyday lab tests, it's just so practical. It works in a huge university hospital, and it works in a small community clinic. And I want to be clear, simple doesn't mean weak. In this case, simple means it's accessible. It means it actually gets used.
Okay, so we've got the problem.
And we've got the tool to help solve it. But now for the most important part of all, how does a simple number actually translate into survival? How does it trigger real life-saving action?
It all boils down to one magic number: 3. This is the threshold. A score of 0, 1, maybe 2, that suggests a mild case. But once you hit 3 or more, oh man, the game completely changes.
Think of a score of 3 or more as a massive, blaring fire alarm going off inside the body. It's a clear, unmistakable signal that a crisis is happening right now. And what do you do when a fire alarm goes off? You don't wait around, right? You act. And that's exactly what happens here.
So what does that emergency response look like? Boom. First thing, that patient is getting an urgent transfer to the intensive care unit, STAT. Second, they're getting aggressive fluid resuscitation to support their organs. Third, the team is proactively looking for the very complications the score predicted. And finally, it gives everyone, doctors and family, a much clearer idea of what the prognosis might be.
And you can see it perfectly right here. That one little score, it's the fork in the road. It's the critical first step that guides the patient's entire journey, from that initial assessment all the way to intensive treatment. It's what stops clinicians from just waiting and seeing and pushes them into acting right now.
And really, that's the whole point, isn't it? This whole thing is about using a simple prediction to actively change the future. The goal is to take a dangerous prediction and turn it into a much, much better prognosis.
Which kind of leaves us with this one big question. In the face of a disease as complicated and unpredictable as severe pancreatitis, is this simple 8-point score really enough to outsmart it? Well, based on everything we've seen, the answer seems to be, yeah, absolutely. In this race against time, it turns out that an elegant, simple tool isn't just an advantage. It's one of the most powerful weapons we've got.